Hello everyone. So today we are going to study about cranial nerves or base of skull. Basic चीजें पता होनी चाहिए what cranial nerves are. The nerves which passes through cranium. And what is cranium, guys? Cranium is brain. The nerves which are coming from the brain is known as cranial nerves. How many cranial nerves we are having, sir? We are having 12 cranial nerves. 12 cranial nerves. The thing which you should know about this is they are bilateral. They are on the both side, on the right side also and on left side also. And base of skull we are going to study, right? So this is skull, right? In this skull, if we will cut it like this and we will see it from the downwards, that is what, guys? That is base of skull. That is base of skull. What you should know about this is, guys, how it will look. Curious how it will look if you will see like this. It will look like this, guys. This is your base of skull. How you will get to know which one is anterior, which one is posterior? Always remember this big hole, guys. This hole is always on the posterior side. This hole is always on the posterior side. So if you know the posterior side, then you can just put it like posterior side. If that is posterior, then above one is opposite one will be anterior side. Right? Posterior, anterior, clear हो गया? Which bone is this? This is ethmoid bone. Which bone is this, guys? This is ethmoid bone. In this bone, we have a structure. This structure is having very small dots in it. We call it perforations. What we call it, guys? We call it perforations. So, these perforations are known as cribriform plate. Cribriform plate. And this structure here, what we will call this, guys? This is crista galli. What is this, guys? This is crista galli. Then here, guys, this structure, this one, guys. This structure is what, guys? This is sphenoid bone. This is what, guys? This is sphenoid bone. This is sphenoid bone. Here, the important structures which we should remember is this. We call it the laser wing of sphenoid bone. What we call it, guys? We call it laser wing of sphenoid bone. Laser wing of sphenoid bone. Then the third bone which you should know is temporal bone. Here, this bone here, and this bone here. They both are what, guys? They are temporal bone. They are what, guys? They are temporal bone. They are temporal bone, and here this big bone, this is what guys, this is occipital bone. This is occipital bone. So they are the structures from anterior to the posterior guys. Now let's focus on the foramens of the base of skull. First foramen we have already discussed. It is what? It is cribriform plate. Then the second foramen which you should know guys is this foramen here. These foramens are known as, here guys, this foramen are known as what guys? This foramen are known as optic canal. They are known as what guys? They are known as optic canal. Optic canal. The third thing which you should know here is, here guys, see, we all know this is what? This is laser wing. Just below the laser wing we have one hole. Just below the laser wing we have the hole. This here guys, it is our laser wing, and this here we have hole guys. Laser wing hole. This hole is known as what guys? Here we have a hole. Superior orbital fissure. This hole are known as what guys? This hole are known as superior orbital fissure. Superior orbital fissure. Superior orbital fissure. Then, can you see this small hole guys? I know the picture is blurred, but it's okay guys. Let's just be with it. ठीक है, तो ये जो नीचे दोनों होल है ये है फोरामेन रोटंडम. Foramen rotundum. Foramen rotundum. फोरामेन रोटंडम से posterior laterally we have one more foramen. Foramen rotundum से posterior laterally we have one more foramen. This foramen here guys, this is known as what? This is known as foramen ovale. This is known as what guys? This is known as foramen ovale. Foramen ovale. Then from foramen ovale also again posterior laterally we have one more foramen here. Foramen ovale, so posterior laterally we have one more foramen. This foramen is known as what guys? This foramen is known as foramen spinosum. This foramen is known as foramen spinosum. Foramen spinosum. Now, on the medial side of foramen oval, we have one more foramen. This is foramen oval. On the medial side, we have one more foramen. This foramen is known as what is? This is known as foramen lacerum. Here guys, this is known as what? This is known as foramen lacerum. Then don't get confused in these four foramens guys. What is the first one? First one is foramen rotundum. On the posterior and the lateral side, posterior-laterally, we have one more foramen. This foramen is known as what? Foramen oval. This foramen is known as foramen oval. On again posterior-laterally, we have one more foramen. This foramen is known as foramen spinosum. And on the medial side of foramen oval, we have one more foramen that is known as foramen lacerum. That is known as always. That is known as foramen lacerum. Then on the temporal bone, this is temporal bone guys. This is full temporal bone, and this is the ending of the temporal bone here. On the ending of the temporal bone, we have one more foramen. Can you see this guys here? This foramen guys. See here. This is the ending of the temporal bone. This is the ending of the temporal bone, and in the ending we have one more foramen. This foramen also, of course, bilaterally we have this foramen, and this foramen is known as what guys? This foramen is known as internal acoustic meatus. This is known as what guys? Internal acoustic meatus. Internal acoustic meatus. After this guys, we have one more foramen, one more hole. Can you see this hole guys? This hole is known as what is this hole is known as jugular foramen. This hole is known as jugular foramen. This hole is known as jugular foramen. And the last one, the biggest hole, this one. The biggest hole here guys, this one. It is known as guys what? It is known as foramen magnum. It is known as foramen magnum. This big hole is known as what guys? This big hole is known as foramen magnum. This big hole is known as foramen magnum. Foramen magnum. Now, let's see if you will take the base of skull like this. So all these structures will also contribute. Let's find out the holes if you get the base of skull like this. It will look something like this guys. It will look something like this. And see, एक पिक्चर मेमोरी बनाने के लिए तुम्हें ये वाली फोटो भी बताना है कि इसमें क्या क्या होता है. इट इज़ नॉट इम्पोर्टेंट. यूजुअली अगर क्वेश्चन आता है तो इसी फोटो से आता है. बट इफ बाई चांस कभी यहाँ से आ गया तो यू शुड नो, है ना. तो ये जो है ये क्या है? ये है लेसरम. This is lesser and guys. Here this is what guys? This is oval. This is oval. Just below the oval, here we have what? We have spinosum. Foramen spinosum. Can you see this hole guys here? This hole. This is what guys? This is hypoglossal foramen. या फिर hypoglossal canal. And this big one here. This big one is what guys? This big one is foramen magnum. Foramen magnum. Somewhere here guys, on this point. This is very rarely asked question. अगर टीचर को तुमसे खुन्नस से हो, तुम वाइवा दे दो फर्स्ट ईयर में टीचर को, तो उसका क्वेश्चन आपसे ये होता है कि शो मी वेरियस एक्सटर्नल अकॉस्टिक मीटर्स. तो जस्ट रिमेंबर दिस इज व्हाट दिस इज एक्सटर्नल acoustic meatus. External acoustic meatus. Here we had internal acoustic meatus. See this. This is what is. This is internal acoustic meatus, and here we have external acoustic meatus. External acoustic meatus. Why we are studying all these holes and foramens in base of skull? From all these cranial nerves are coming from these holes. What are cranial nerves? We have already discussed. The nerves which are coming from the brain is known as cranial nerves. Is known as what is cranial nerves. Let's write the definition just for the formality. Cranial nerves क्या होती है? कोई नहीं पूछेगा, बस ताकि तुम्हें याद रहे इसलिए अपन लिख रहे हैं. The nerves which are coming from the brain. The nerves which are coming from the brain is known as cranial nerves. टोटल कितनी होती है पता होना चाहिए. टोटल 12 in pair. Total 12 in pair. Let's discuss them. कौन कौन सी होती है? So cranial number 1 is I have one mnemonic. अगर पसंद आए तो ठीक है, नहीं तो अपना बना लेना, ऐसा कुछ है नहीं इम्पोर्टेंट इसमें. I remember like triple O double T A Fag VAH. Otafagua. Cranial number 1, cranial number 2, number 3, number 4, 5, 6, 7, 8, 9, 10, 11 and 12. These are our 12 cranial nerves. Let's name it. The first one is what guys? The first one is olfactory nerve, olfactory nerve. What is olfactory nerve, guys? Olfactory nerve is a nerve which helps us in smell. Olfactory nerve gives us what? The smelling sensation. एक क्वेश्चन आता है यहाँ पे. That question is how you will find out if cranial nerve number 1 is paralyzed. आपको कैसे पता चलेगा कि cranial nerve number 1 is not working properly? So what we will do, we will give the patient 3-4 kind of smells. मान लो sweet smell और कौन सा दे सकते हैं? रोज की स्मेल दे दो, लीली की स्मेल दे दो और सीवेज की स्मेल दे दो. ठीक है. If the patient is not finding the smells, but he can or the patient can find the sewage smell. Why sewage? Because in sewage we have urea. In sewage we have urea, and urea is irritant to olfactory nerve. तो अगर भैया को कोई और स्मेल नहीं आ रही है पर ओनली यूरिया की आ रही है तो मतलब olfactory nerve में कुछ ना कुछ गड़बड़ है ना? इतना समझ लो. Second we have optic nerve. Optic nerve किस काम आती है गाइस? ये it helps in vision. अभी डिटेल में पढ़ेंगे सब कुछ, बस इतना थोड़ा सा पता कर लेना, है ना? It helps in vision. Number 3 is guys oculomotor nerve. Then we have T, trochlear nerve. Then again T, trigeminal nerve. This trigeminal nerve is having 3 parts, guys. This trigeminal nerve is again divided into 3 parts. The first is V1, V2 and V3. The first one is ophthalmic branch. The second one is maxillary branch. And the third one is known as mandibular branch. This trigeminal nerve comes into the 3 parts. The first one goes into the ophthalmic, means for the eye. Second one is for the maxillary area, and the third one is for the mandibular area. Ophthalmic is for the eye, maxillary is for the maxilla, the bone, and the mandibular is also for the mandibula, for this bone. Okay. Then we have A. A is for abducens nerve. Next one is what, guys? Abducens. Abducens nerve. Then we have facial nerve. Facial nerve. Which nerve we have, guys? We have facial nerve. Important facts about the facial nerve which you should know. What is that, guys? Anyone? अच्छा anyone पे कैसा ही है? रिकॉर्ड नहीं हो रहा है. रिकॉर्ड हो रहा है मतलब लाइव नहीं चल रहा. आदत डालनी पड़ेगी रिकॉर्ड करने के लिए. Facial nerve. If there is an injury in this nerve, we can have two kind of deformities. We can have two kind of deformities. The first one is known as always. The first one is known as Bell's palsy. Bell's palsy. And another one is known as facial palsy. The Bell's palsy and the facial palsy. How to differentiate this, guys? How to differentiate this? In Bell's palsy, half of the face sensations, half of the face sensation either can be motor or can be sensation. Will be lost. In facial palsy, full face sensation will be lost. So, if you have injury on the facial nerve, you can have two kind of deformities. One is this Bell's palsy, another one is facial palsy. In Bell's palsy, what will happen? In Bell's palsy, half of your face sensation will be lost, and in facial palsy, your full face sensation will be lost. How you will find out, guys? You will find out while telling the patient, put your eyebrows up. If patient is able to put his both eyebrows up, that means he is not having any kind of facial nerve deformity, mota-moti. But if patient is trying to move his both eyebrows up, but he can only move his one eyebrow up, not the another one. He is only able to move his one eyebrow up, but not the another one. That means the side which the eyebrow is down is the side where he is having the paralysis, facial nerve paralysis. So that's why that side is not having any kind of sensations. What another thing you can see? You can see ptosis. The eyelid is down. So what we were discussing, guys, if your facial nerve is injured, you can have two kind of deformities. How you will check? The first thing what you will do is you will look at the face. If the person is having his one eyelid down, then the another one, we call it ptosis. What we call it, guys? We call it ptosis. The one eyelid down. He might have, you cannot be 100% sure, of course you have to do the MRI scans and other things, but at the physical appearance, you can have the differential diagnosis. So at the physical appearance, if a person is looking like this, his one eyelid is a bit down and another one is normal, then he can have, like you can choose it, the differential diagnosis of facial nerve injury. What is the other thing which you can do, guys? You can tell patient to put your both eyebrows up. Once you will put both eyebrows up, what will happen? If the patient is able to move his both eyebrows, means he is having his facial nerve intact, there is no problem in it. But if he can do only one eyebrow up but not the another one, only one eyebrow up but not the another one, means the eyebrow which is down, on that side he is having the injury, on that side he is having the injury. And in facial palsy what will happen? He will not able to move his both eyebrows up, he will not able to move his both eyebrows up. Okay, so next is A. A is for auditory nerve. A is for what, guys? A is for auditory nerve. Auditory nerve, also known as vestibulocochlear nerve. Another one is from G we have glossopharyngeal nerve. Then from the 10th one is the vagus nerve. Then accessory nerve. This accessory nerve is having two parts. One is the cervical branch, and another one is the spinal branch. And the last is what, guys? Last is hypoglossal nerve. Last one is hypoglossal nerve. These are our 12 cranial nerves, guys. These are our 12 cranial nerves. How to remember it? Otta phagua. O is for the olfactory nerve. Again O is for the optic nerve. Then oculomotor nerve, trochlear nerve, trigeminal nerve, abducens nerve, facial nerve, auditory nerve, also known as what? Also known as vestibulocochlear nerve. Then we have glossopharyngeal nerve, vagus nerve, accessory nerve, and hypoglossal nerve. These are our 12 cranial nerves. Important to know here is, guys, trigeminal nerve is having three parts, known as what? Known as V1, V2, V3. V1 is ophthalmic branch, V2 is maxillary branch, and V3 is what, guys? Mandibular branch. V3 is mandibular branch. Then in facial nerve we have what, guys? Injury. If that injury is only on the one side of the face, we will call it Bell's palsy. If it is on the both side of the face, we will call it facial palsy. What is happening in both these things are, we are losing our sensations, either sensory sensations or the motor sensations. So first of all, let's make a table. In that, the first heading will be name of foramen. Then we are going to discuss every foramen, the structures, passing from it, the structures passing from it. Name of the foramen, then the structures which are going to pass from it, and then what are the functions of those structures. The first foramen which we are going to discuss is what, guys? The first foramen which we are going to discuss is cribriform plate. What is this, guys? Cribriform plate, we have already discussed it. Cribriform plate is the part in the ethmoid bone. This is ethmoid bone. It is a part in the ethmoid bone. We have on the medial side of the ethmoid bone, we have what? We have some perforations. In the medial side of the ethmoid bone. This perforation fully combined is known as what, guys? Is known as cribriform plate. Is known as cribriform plate. What is cribriform plate, guys? Cribriform plate is the perforation in ethmoid bone. Perforation in ethmoid bone. Which structure passing through it, guys? The structure which is passing through it is cranial nerve number 1. What is the name of that? Is olfactory nerve. Olfactory nerve. What is the function of olfactory nerve? Olfactory nerve का function क्या है? Is smell. What does olfactory nerve do, guys? Olfactory nerve helps in smell. Second is optic canal. Second is what, guys? Optic canal. This optic canal, where we will find it? We'll find it just medial to the laser wing of sphenoid bone. Just medial to the laser wing of sphenoid bone. Which structure is passing through it, guys? The structure which is passing through is optic nerve. Optic nerve and ophthalmic artery. Optic nerve and ophthalmic artery. What optic nerve is useful for? Optic nerve is useful for seeing the things, to see. And ophthalmic artery is giving the blood supply to the eye. Is giving blood supply to eye. The third which we are going to discuss is superior orbital fissure. Superior orbital fissure. Very important structure, guys. Why? Because from this we have 4 different structures passing through it. We have 4 different structures which are passing through it. What are those 4 structures, guys? First of all, we have oculomotor nerve. Oculomotor nerve. Then we have trochlear nerve. Ophthalmic branch of trigeminal nerve. Ophthalmic branch of trigeminal nerve. And the last thing which is going from it is abducens nerve. Abducens nerve. You should know about the muscles of eye. The muscles of eye. In total, there are 6 important muscles of eye. Important as in, for this topic we have to know at least these 6 muscles of the eye. Out of them, 4 are rectus muscle, 4 are rectus muscles, and 2 are oblique muscles. 4 are rectus muscles and 2 are oblique muscles. Very easy to remember, guys. What are those 4 rectus muscles? They are superior inferior, lateral and medial. Superior rectus, inferior rectus, lateral rectus and medial rectus. What about oblique, guys? On oblique we have only two types. They are superior and inferior. Superior and inferior. Let's discuss it on the furthermore level, guys. Just suppose this is our eye. Okay, this is the eye. So we have two muscles on the superior and inferior side, which is superior oblique and inferior oblique, and we have four rectus muscle. We have four rectus muscles: superior rectus, inferior rectus, lateral rectus and medial rectus. No point of discussion in superior and inferior. Right? Superior rectus and inferior rectus will be easy to find out. But how you will find out which one is lateral and which one is medial? At the side of nose, you will have medial rectus. You will have medial rectus, and on the opposite side of that nose, you will have lateral rectus. You will have what, guys? You will have lateral rectus. Why I am telling you these muscles, guys? Because here, see, we have the structures which are passing from superior orbital fissure, and the structures which are passing from superior orbital fissure are having what? Are having oculomotor nerve, trochlear nerve, oculomotor nerve, which is nerve number what? Oculomotor nerve is nerve number 3. Oculomotor nerve is what, guys? Oculomotor nerve is nerve number 3. Trochlear nerve, which is nerve number 4. Trochlear nerve, which is what? Nerve number 4. And abducens nerve, which is nerve number 6. So number 3, number 4 and number 6. Number 3, number 4 and number 6. They are important. 3, 4 and 6. Why they are important? Because all these three nerves are supplying to these muscles. All these three nerves are supplying to these muscles. For remembering this, you have to know one mnemonic, which is very easy. Of course, you have heard it earlier also. That is LR6 SO4 and rest all 3. LR6 SO4 and rest all 3. What it means, guys? The lateral rectus is supplied by 6th cranial nerve. The lateral rectus is supplied by what? Is supplied by 6th cranial nerve. What is 6th cranial nerve, guys? 6th cranial nerve is abducens nerve. Then another one is what? Another one is SO4. Superior oblique is supplied by 4th cranial nerve. Superior oblique is supplied by 4th cranial nerve. Superior oblique is supplied by 4th. What is the name of 4th cranial nerve? nerve. Superior oblique is supplied by trochlear nerve. And rest all muscles. What we have discussed? We have discussed this lateral rectus is supplied by abducens nerve. Then superior oblique is supplied by what? Superior oblique is supplied by trochlear nerves, and rest all is supplied by third cranial nerve. What is third cranial nerve, guys? Third cranial nerve is oculomotor nerve. Oculomotor nerve. So inferior rectus, inferior oblique, medial rectus and superior rectus, all these four muscles are supplied by the third cranial nerve, which is oculomotor nerve. So the functions of all these three nerves, the abducens nerve, the oculomotor nerve and the trochlear nerve, the function of these is what? The function of this is movement of eyeball. All these muscles are helping in what? Helping in moving our eyeball. All these muscles are helping in moving our eyeball. Then the next is ophthalmic branch of trigeminal nerve. In short, what we can write? V1. What is the function of this? The function of this is giving sensations to the orbital area. Whatever you are feeling on the orbital area is because of which nerve? Is because of the first branch of the trigeminal nerve, also known as ophthalmic branch of the trigeminal nerve. ठीक है, इतना सबको समझ में आ गया? Next is what? Next is foramen rotundum. This foramen rotundum is also a very important structure. Why it is very important structure? Because the second branch of the trigeminal nerve, that is maxillary nerve. The second branch of the trigeminal nerve is the maxillary branch, V2, is coming from this foramen rotundum. What it is doing, guys? It is doing sensation to the maxillary area. Sensations to the maxillary area. That's all you have to remember about foramen rotundum. Another thing which you have to remember is about foramen ovale. This foramen ovale is having 4 different kind of structures which are passing through it. How you can remember them? You can remember them as male, M-A-L-E. ओवेल मतलब गोला. फोरामेन ओवेल से मेल निकलता है. ठीक है. मेल के अंदर क्या क्या है? मेल के अंदर है फर्स्ट ऑफ ऑल mandibular branch, which is what is V3. Mandibular branch V3. A से क्या है guys? Accessory meningeal artery. Accessory meningeal artery. Then we have lesser petrosal nerve. Lesser petrosal nerve. And last one is emissary vein. Emissary vein. Emissary vein. V3 is mandibular branch of trigeminal nerve. Then A is accessory meningeal artery. This accessory meningeal artery is giving blood supply to brain. Then we have lateral petrosal nerve. This we will study later, not in this topic because this is not a cranial nerve. And emissary vein. Emissary vein we will study when we will study about eye drainage. Eye drainage. The tears of the eye and the residuals of the eye is ending in the emissary vein. How? We will discuss it later. Now let's come back to the mandibular branch of trigeminal nerve. This mandibular branch of trigeminal nerve gives sensation to the mandibular area. Sensations to the mandibular area. Also, the general sensation of anterior 1/3 of tongue. General sensation of anterior 1/3 of the tongue. We have tongue, and in this tongue we have three different parts. The first one is the base of the tongue, another one is posterior 1/3 and anterior 2/3. Now let's see the sensations in these areas, guys. Let's see the sensations in these areas. So there are two different kind of sensations which are present in the tongue. Two different kind of sensations which are present in the tongue. One is known as general sensation, another one is known as general sensation, and another one is known as spatial sensation. One is known as general sensation and another one is known as spatial sensation. The general sensation is every sensation except taste. Every sensation except taste will come in general sensation, like it is hot, it is cold, kind of those sensations. Okay, so the base of tongue is supplied by cranial nerve number 10, that is vagus nerve. It will give sensations, both kind of sensations, general sensation and the special sensation, to the base of the tongue. Next is posterior 1/3 part. This posterior 1/3 part, general sensation and special sensation both are given by cranial nerve number 9. What is the name of this cranial nerve number 9, guys? Cranial nerve number 9 is known as accessory nerve. It is what? It is supplying the general and the special sensations in the posterior 1/3 part of the tongue. This is supplying sensations in posterior 1/3 part of the tongue. Then we have what? Then we have anterior 2/3 part of the tongue. Very, very important, guys. Why it is important? Because it is having two different nerves. For general sensation is different, and for the special sensation it's different. So for the general sensation, we have V3. The mandibular branch of the trigeminal nerve will supply the general sensations to the anterior two-third part of the tongue, and the facial nerve is supplying taste to this anterior two-third part of the tongue. The seventh cranial nerve, which is the facial nerve, is supplying to the anterior two-third part of the tongue. What it is supplying? The spatial sensation. What is that spatial sensation? That is taste. ठीक है, क्लियर है इतना? आगे चलते हैं. Foramen spinosum. This foramen spinosum is having a very special structure. That special structure is known as medial meningeal artery. Medial meningeal artery. This medial meningeal artery is very important to know. Why? Because this meningeal artery, if this artery will get ruptured, what will happen, guys? If this artery will get ruptured, we can have extradural or epidural hematoma. Extradural or epidural hematoma. If this extra epidural hematoma will happen, what will be the treatment? Treatment will be the surgery, and the name of surgery is known as burr hole surgery. Burr hole surgery. So what will happen? A patient will come with the history of injury on head, especially where? Especially on the pterion side, on the pterion side. The patient will come with the symptoms of कि डॉक्टर साहब जब मेरे लगी थी तो मैं बेहोश हो गया था. बेहोश मतलब अनकॉन्शियसनेस. Another one is what, guys? कि मैं बेहोश हो गया था और अब भी मुझे, जब भी मैं थोड़ा बहुत अपना सर हिलाता हूँ, कुछ होता है तो मुझे चक्कर आते हैं. मुझे क्या आते हैं, गाइस? मुझे चक्कर आते हैं. ठीक है, पेशेंट ये स्पेसिफिक हिस्ट्री के साथ में आएगा. Burr hole surgery is the surgery or the treatment. In management, what will give? Management में क्या होगा, guys? Management में you have to admit the patient. Then तुम्हें पता है कि उसके सर में लगी है और वो बेहोश भी हुआ है, एंड हो सकता है कि उसका बीपी भी ऑन द हायर साइड हो. तो व्हाट यू विल डू टू दिस पेशेंट? यू विल गो फॉर द सीटी हेड और ब्रेन, वॉट एवर यू से. सीटी हेड और सीटी ब्रेन करवाएंगे. सीटी हेड और सीटी ब्रेन करवाने पे जो सीटी स्कैन हमारे पास में आएगा, उसमें वी विल सी this kind of structure, guys. We will see this kind of structure. क्या बोलते हैं हम इसको? This is known as epidural or extradural hematoma. How it will look, guys? It will look like, अंग्रेजी भाषा में बाइकॉन्वेक्स शेप्ड हेमेटोमा. क्यों बाइकॉन्वेक्स क्यों बोल रहे हैं? क्योंकि दोनों साइड से कॉन्वेक्स शेप बना रहे हैं. एंड द एजेस विल बी द पिन पॉइंट एजेस. एंड द एजेस विल बी, guys, पिन पॉइंट एजेस. व्हाट इज दिस, guys? बाइकॉन्वेक्स shaped. If you cannot remember like this, then you can remember it like idli shaped. Idli shaped hematoma. Idli shaped hematoma. How I remember, guys, my favorite food is idli sambar, by the way. So whenever idli is come to my mind, then in my mind the next thing which is coming is the idli is made by my mama. MMA, by my mama is best. जो इडली मेरी मम्मी बनाती है वो सबसे बेस्ट इडली है. So the problem is idli shaped hematoma, also known as extradural or epidural hematoma. Why this problem is occurring? Because of my mama. My medial meningeal artery is getting ruptured. My medial meningeal artery is getting ruptured. Because of this I am having what? Because of this I am having this kind of deformity in my head, and it is known as epidural or extradural hematoma. What all things you have to remember? It is a biconvex shaped hematoma, and the points are pinpointed points. How you will manage this patient? You will admit this. First of all, you have to do the CT scan. After CT scan, you know that the patient is having. Okay, first of all, you have admitted the patient. Then you said to do the CT scan. In CT scan, they saw this idli shaped hematoma. Then you are confirmed that it is epidural hematoma. Until then, if the patient's blood pressure is high, on the higher side, what you will do? You will put IV mannitol to this patient. So it will decrease the blood supply or decrease the pressure of the blood which is supplying to the brain. Okay, it will decrease the pressure of the blood which is supplying to the brain. अभी के लिए इतना याद रख लो, आगे का अपन बाद में देखेंगे. ठीक है. This is all about foramen spinosum, which you should remember, guys. Next one is what? Next one is foramen lacerum. Next one is foramen lacerum. In foramen lacerum, we have internal carotid artery. Internal carotid artery. This internal carotid artery supplies blood to two different structures. Supplies blood to the brain and to the eye. Internal carotid artery is supplying blood to the brain and the eye. Blood to the brain and the eye. What is next one, guys? Next one is internal acoustic meatus. Internal acoustic meatus, which is situated at the end of the temporal bone. From this internal acoustic meatus, we have three special structures which are coming out. The first one is facial nerve. And the second one is vestibulocochlear nerve. And the third one is labyrinthine artery. Three structures are coming out from the internal acoustic meatus: the facial nerve, the vestibulocochlear nerve, and the labyrinthine artery. What are the functions? The facial nerve is having functions like face expressions, and taste to anterior to third part of the tongue. Face expressions and anterior to third part of the tongue ka taste is given by what? Is given by facial nerve. Then we have vestibulocochlear nerve. This vestibulocochlear nerve is supplying to inner ear. This inner ear is having two parts, guys. Of course, if you have studied about ear, then you know that inner ear is having two parts. The first one is known as vestibule and another one is known as cochlea. The first one is known as vestibule and another one is known as what, guys? Another one is known as cochlea. Inner ear, this part here is vestibule and this part is known as cochlea. This part is known as vestibule and this part is known as cochlea. In vestibule we have two different parts known as utricle and saccule. Vestibule is having two parts, utricle and saccule. And what is the function of vestibule, guys? Function of vestibule is to give balance and equilibrium. Balance and equilibrium. Balance and equilibrium. See guys, vestibule के अंदर दो पार्ट जो होते हैं utricle and saccule. These two parts are giving linear balance. And cochlea is for the hearing, guys. The function of the cochlea is hearing. Function of the cochlea is what, guys? Function of cochlea is hearing. So the vestibulocochlear nerve is giving us what? Is giving us the balance, the equilibrium and the hearing. And the last is labyrinthine artery. Last is what, guys? Labyrinthine artery. This labyrinthine artery is supplying blood to the ear. Is supplying blood to the ear, specifically inner ear. Specifically what, guys? Inner ear. Next is what, guys? Next is jugular foramen. Jugular foramen. This jugular foramen will give three more structures. The first one is glossopharyngeal nerve. The second one is vagus nerve, glossopharyngeal nerve, vagus nerve, and the third one is accessory nerve. Glossopharyngeal nerve, vagus nerve, and accessory nerve. What is the number of glossopharyngeal nerve, guys? The number of glossopharyngeal nerve is number 9. Then the vagus nerve, which is number 10, and the accessory nerve, which is number 11. Accessory nerve, which is number 11. This glossopharyngeal nerve will give general and special sensations to the posterior 1/3 part of the tongue. To the posterior 1/3 part of the tongue. Important to know is this much only. Next is, guys, vagus nerve. In vagus nerve we have 2-3 different points which we should remember. The first is it is the longest cranial nerve. It is the longest cranial nerve. And what is the function? The function is it's supplying the parasympathetic actions. It is supplying the parasympathetic actions. What we are discussing, guys, we are discussing the 10th cranial nerve, which is the vagus nerve, and this vagus nerve is having two important points to remember. The first one is it is the longest cranial nerve with the maximum number of branches, and the second is it is supplying the parasympathetic actions. It is doing what, guys? It is supplying the parasympathetic actions. And the accessory nerve, this nerve is giving movements to the neck and shoulder. Important thing to remember is it is giving movements to shoulders and neck. Which nerve is helping in movement of shoulder and neck? The nerve which is helpful is accessory nerve. पंजाबी डांस में कंधे हिलते हैं, गर्दन हिलती है, क्या काम आता है? एक्सेसरी नर्व काम आती है. ठीक है. नेक्स्ट इज हाइपोग्लोसल कैनाल. This hypoglossal canal will give a structure which is known as hypoglossal nerve, which is the 12th cranial nerve or the last cranial nerve. This hypoglossal nerve will help in what? This hypoglossal nerve will help in movement of tongue. This hypoglossal nerve will help in movement of the tongue, and the movement of the tongue is helpful for what? Is helpful for chewing, is helpful for speaking, and is helpful for what is this, guys? Ice cream. What you do to the ice cream? You lick the ice cream. So licking. The movement of tongue is helpful for chewing, speaking, and licking. Then we have the last foramen, and that foramen is known as, guys, foramen magnum. That foramen is known as foramen magnum. The structures which are passing through foramen magnum is medulla oblongata. This is very important structure, guys. Once we will study about CNS, we will study this medulla oblongata again. And then we have spinal branch of accessory nerve, and left and right vertebral artery, and spinal artery. Left and right branches of vertebral artery and spinal artery. This accessory nerve, what is the function is? Accessory nerve का spinal branch of the accessory nerve is having the function in, again, the same neck and shoulder movements. Movements of neck and shoulder. So this is the table, guys. All the foramin's of the base of skull, what all structures which are passing through them, and what are the functions of those structures. The important functions of those structures are here. YouTube पे चैनल बना रहा हूँ यार मैं, है ना, YouTube पे चैनल बना रहा हूँ which names is only serotonin. यहाँ ये वीडियो तुम्हें वहीं पे मिलेगी, उसी चैनल पे मिलेगी. पसंद आए तो ऐसे थोड़ी सी मार्केटिंग कर देना, सब्सक्राइब कर देना, शेयर कर देना, लाइक कर देना, क्या क्या करना पड़ता है. ऑल्सो आई हैव इंस्टा पेज with the same name and telegram page or telegram group also of the same page. Whenever I will go live, I will put message in my telegram group. I will message in my telegram group. You can see it, you can join it whenever you want. This is just a sample video to check कि all things are working properly or not. ऐसे पहली बार मतलब ऐसे लैपटॉप लगा के टैबलेट पे पढ़ाने का ट्राई कर रहा हूँ मैं, तो let's see where it goes. Hope for the best. I hope you will not have any kind of doubt from this topic, which is cranial nerve and the base of skull. वीडियो देख के जाना. Why I choose this topic for the first video of mine is कि जब मैं समरकंद में पढ़ाता था, समरकंद स्टेट मेडिकल यूनिवर्सिटी में, तो वहाँ पे फर्स्ट ईयर MBBS स्टूडेंट्स की जब फर्स्ट एनाटॉमी क्लास लगती थी, तो दैट वाज ऑफ दिस टॉपिक ओनली, द क्रेनियल नर्व्स एंड द बेस ऑफ स्कल, द क्रेनियल नर्व्स एंड द बेस ऑफ स्कल. तो मैंने सोचा कि ओके, इफ आई एम स्टार्टिंग माय दिस चैनल एंड आई एम अपलोडिंग द फर्स्ट वीडियो, तो लेट्स पुट द फर्स्ट वीडियो ऑफ द सेम टॉपिक व्हाट the students used to study in their first class of anatomy. I was taking class of local students at that time, and they wanted to record a video of this specific topic. So I just want to show you all. If you all like it, then let me know. This is the video. I hope the voice will come to you all and you will listen it अच्छे से. You can see some holes.
Yes.
So these holes are called perforations in ethmoid bone. Ethmoid bone perforations known as cribriform plate. Cribriform plate. From here, first cranial nerve. What is the name of first cranial nerve? Olfactory nerve comes from here.
Okay.
Okay.
Yes.
Anyone ask you from this structure where olfactory nerve come? Cribriform plate. Okay. Second is sphenoid bone. This is sphenoid bone. On sphenoid bone, this is lesser wing.
Yes, lesser wing.
Lesser wing of
It's great wing.
sphenoid bone.
Okay.
Yes.
Above this lesser wing, we have one hole. See.
Yes.
This
Optic
is
foramina.
we call in English we call this optic canal.
Okay.
Optic canal. From here, two things pass. One is optic nerve, second cranial nerve pass, and another thing is ophthalmic artery. Artery. The blood supply of eye
Okay.
also comes from optic canal.
Okay.
Okay. After this, see, lesser wing of sphenoid, we have one hole here. Can you see?
Yes.
This hole, both side. This we call superior orbital fissure. Superior orbital fissure. From this superior orbital fissure, cranial number 3, cranial number 4, cranial number 6. Okay, what is the number of 3? Oculomotor, 4 trochlear, 6 abducens.
Yes.
And trigeminal nerve, first branch, ophthalmic
Okay.
branch of trigeminal nerve. Everything comes from this. Okay,
Yes.
no problem.
Yes, we got it.
I repeat again. Cribriform plate of olfactory nerve, optic canal, optic nerve and ophthalmic artery, superior orbital fissure. Cranial number 3, oculomotor, 4 trochlear, 6 abducens, and 5 first branch, V1, first ophthalmic branch. We have 3 branches, right?
Yes.
So first branch comes from this, okay? Next is this. This is foramen rotundum. Foramen rotundum.
Yes.
This foramen rotundum, see, first this, okay?
Yes.
Foramen rotundum. What comes from here? Maxillary branch of trigeminal nerve. This second one.
Yes. Okay.
Second branch of trigeminal nerve will come from foramen rotundum. Then foramen ovale.
Ovale.
Foramen ovale.
Ovale.
Mandibular branch of trigeminal nerve.
Okay.
Mandibular branch, third branch of trigeminal nerve will come from this, okay?
Okay.
No problem.
Yes.
From foramen ovale, medial side, this is medial, okay? This is medial. So from foramen ovale, medial side, foramen lacerum. Foramen lacerum. From here, internal carotid artery. Internal carotid artery. Internal carotid artery, okay?
Yes.
That will come. From foramen ovale, posterior means down, lateral to the side. This is foramen spinosum. Foramen spinosum. From this spinosum, medial meningeal artery. Medial meningeal artery. If this artery will get broke, we will have epidural hematoma. Here we will have hematoma. Clotting of blood. Blood will clot here.
Okay.
She will explain you after, okay?
Okay.
Clotting of blood will come. We will call that epidural hematoma. Okay? What is this? Foramen spinosum. After that we have internal acoustic meatus. Both sides, see.
Yes.
Internal acoustic meatus. Internal acoustic meatus. From this, cranial nerve number 7. What is number 7?
Facial. Yes.
Number 8?
Number 8. But acoustic.
Auditory.
Auditory. Yes.
Another name of auditory?
Vestibular cochlear.
Vestibulocochlear nerve. So, facial nerve, vestibulocochlear nerve, and one more thing, labyrinthine artery. Remember, okay? Labyrinthine artery will also go from here. Labyrinth is for inner ear. You see two names, cochlea and vestibule.
Yes.
Inner ear.
Yes.
Cochlea and vestibule together we say labyrinth.
Yes.
Okay, so labyrinthine artery. Labyrinthine artery, cranial nerve number 7, cranial nerve number
8.
7, 8 and labyrinthine artery will come from internal acoustic meatus.
Okay.
No problem.
Yes.
Next is jugular foramen. Both sides. See. Jugular foramen. Jugular foramen. From jugular foramen, cranial nerve number 9, 10, 11. 9 is glossopharyngeal, 10 is vagus, 11 is accessory nerve. Okay.
Yes.
Glossopharyngeal, vagus, accessory will come from jugular foramen. Okay.
Yes.
Next is, see, hypoglossal canal. Hypoglossal canal. Okay.
Yes.
Hypoglossal canal is for 12th nerve. Okay, both sides. This is also hypoglossal canal here, and here also hypoglossal canal. Yes.
Yes.
So this is for 12th nerve. What is 12th nerve? Hypoglossal nerve. Work of 12th nerve? I don't tell. Yes. I tell only till 10.
Yes.
Okay, so 11 and 12 I will tell you right now after this video. This is foramen magnum. Foramen magnum is containing medulla oblongata, spinal nerve, spinal cord, and vertebral arteries. Right and left vertebral arteries, medulla oblongata, spinal cord, and also that you say na spinal branch of accessory nerve. Spinal branch of accessory nerve also go from this medulla oblongata.
Okay.
Accessory nerve from jugular foramen, and spinal branch of that nerve will go from medulla oblongata. Okay?
Yes.
Everything clear?
Yes.
Okay. Finish. ये है ना यार गाइस, फर्स्ट वीडियो थी तो अभी मेरे को पता नहीं है कि कैसी बनी है, अपलोड होने के बाद में क्या आएगा। जस्ट कुछ भी गड़बड़ लगे या कुछ भी सजेशंस हो तुम्हारे पास, या फिर जो भी टॉपिक्स तुम्हें पढ़ने हो जस्ट लेट मी नो। ठीक है, कमेंट कर सकते हो, या टेलीग्राम ग्रुप है ओनली सेरोटोनिन पे की, ओनली सेरोटोनिन पे जाके तुम वहाँ पे मैसेज कर सकते हो। एंड अभी ऐसा है कि इफ़ आई विल गेट अ गुड वाईफाई देन आई विल टेक द लाइव क्लासेस, इफ़ नॉट देन आई विल रिकॉर्ड, एडिट एंड शेयर इट टू यू, नो इश्यूज़, है ना। पर यह है कि अभी जब जब तक हम घर पे हैं, जब तक हमारी वैकेशन चल रहे हैं, तब तक एटलीस्ट वी हैव टू स्टडी फ्रॉम 10 to 15 hours अ वीक। 10 to 15 hours अ वीक हमें पढ़ना है, so that after 6th year completion when we'll go to India we have to give FMG exam, right? वहाँ पे तकलीफ नहीं आए। ठीक है, उस चीज़ का ध्यान रखना है अपने को। बाकी डू वॉट एवर यू वॉन्ट, छुट्टियां हैं, मज़े करना मत भूलना, घूमना मत भूलना, क्योंकि उज़्बेक जाओगे तो इंडिया की सबसे ज़्यादा याद आएगी, है ना। जस्ट चिल, एन्जॉय, थैंक यू। आई होप यू विल लाइक दिस वीडियो, योर कॉन्सेप्ट्स विल बी क्लियर। अभी लास्ट में दिखाई थी मैंने वीडियो, ये एक समरी हो गई जो भी हमने ऊपर का पढ़ा उसकी, है ना। मैं तुम्हें एक PDF भी शेयर करूँगा, तो तुम उस वो PDF तुम्हें मेरे टेलीग्राम ग्रुप पे मिल जाएगी। तो तुम उस PDF को, अगर तुम्हारे पास में आईपैड है या फिर टैबलेट है, तो तुम PDF को उसमें डाल के अपने नोट्स खुद बना सकते हो। और अगर नहीं है तो प्रिंट इट आउट एंड राइट इट विद द पेपर, रेड ब्लू ब्लैक पेन, 3-4 पेन मिला के उससे भी अपने लिए सुंदर से नोट्स बनाओ, सो दैट नोट्स अच्छे होंगे तो पढ़ने में मज़ा आएगा। ठीक है, थैंक यू गाइस, थैंक यू वेरी मच, हैव अ नाइस टाइम, बाय बाय।